One of my first powerful conversations with a patient about a book was based on the book Beautiful Boy. This mother had a teenage daughter who died because of her addiction. I knew that. I had always asked after her in her grief, but after reading a father's description of his son's addiction, we entered into a much deeper conversation about addiction as a brain disease, navigating when your child has an addiction that is not yours to manage, in addition to how horribly sad and hard it is to see a young life be affected and even end because of addiction. Another powerful experience with a book and a patient was a woman I saw who was in her late 50s who had aggressive breast cancer. While at the time she was doing very well, the likelihood that she would pass away from that cancer was very high. She knew that, her team knew that, her family at some level knew that. They had a very difficult time discussing that with her. And what happens in that situation is that leaves that woman very much alone. I gave her my copy of The Bright Hour by Nina Riggs, which is a memoir written by a young woman who was a poet about her experience with aggressive breast cancer, from which she eventually passed away. My hope was that if her mother and her husband couldn't talk to her about her own situation, they could talk about Nina Riggs in a much less threatening, much more available way, and talk about facing what it is to be vibrant and young with terrible disease, to which you have to face, you might die. She sent me the most beautiful hand-created thank you card about being able to see herself in Nina Riggs' experience, as well as talk with her family about what she was living through. Often at the beginning of my visits with my patients, we'll talk about what we're reading and run a list of what we've recently enjoyed. What happens when we then discuss their medical conditions is it will occur to me to share with them a book that might be about a family member with addiction, or the cancer experience, or even things like infidelity and affairs. And to have those books at the ready to share with them so they can understand those concepts better has been a really joyful part of my clinical practice. I've talked with my patients about books that deal with addiction, cancer, mental health, relationships. I'm excited about Read, Talk, Grow to allow more people to have these conversations and connect other women to books that feature these topics so we all can be more understanding and empathetic toward one another.